Be noted, and I call the member for Goldstein.
Thank you, Deputy Speaker, and it's a pleasure to be able to speak this evening, particularly on the issues facing aged care following the Royal Commission on Aged Care. Now, I don't think I'd be alone, Deputy Speaker, in this chamber or elsewhere in saying they haven't had the chance to read the full volumes of the report, but we all know that it makes, for what we can read so far, sobering reading. The reality is it confronts us and holds a mirror up to the sector that should disturb us all. But we also need to acknowledge there are many good people who operate, manage, own and run and support people in aged care across Australia. And the point of this Royal Commission was to put sunlight onto the system to make sure that those who are vulnerable and need assistance and care get it. And where there is wrong, it is righted, and to respect the contribution that those who contribute to the system deserve. But of course, it does also highlight concerns of neglect. And last weekend I was in Hyatt in the wonderful electorate of Goldstein doing a listening post, and one of the most passionate local residents who came to speak to me raised specifically the concern about aged care and what was to be done about it, not just following the Royal Commission, but as part of making a sustainable system for Australia. Because every Australian should have the opportunity to live a life and retire with dignity after a full contribution to the fabric of our nation, particularly at the most vulnerable stage, with care, support and passion and compassion, so that they can live out their days with dignity. This is an essential part of the generational contract which builds the strength of our country. Through 2 years of testimonies from 641 experts, residents and families of more than 10,000 submissions, the Royal Commission has heard how a myopic aged care system is failing catastrophically to meet the structural challenges of our ageing society. Too many older Australians are sitting on wait lists, unable to access the care that they critically need. There's a misallocation of capital. We have centralised uniform services that don't always mean that people receive the care they need. And many are being unnecessarily forced out of the comfort of their homes and into residential aged care simply because the system was too slow to respond to their less financially burdensome needs. Inadequate training of aged care staff and the under-availability of professional medical assistance is leading to an oversubscription of psychotherapeutic drugs, misdiagnosis, medical neglect and premature deaths in care. And of course that is also against the backdrop of significant challenges of the number of people going to aged care with dementia and the support and assistance they need. And then highlighting the vulnerability from 2019 to 2019, there were 5,718 allegations of assaults at the hands of staff members, corrupting the ethic of dignity and respect which should sit at the heart of the aged care system. And this consequences are fundamentally human in nature. The Commissioners were quick to illustrate in their report that our failing aged care system is directly linked to profound and unprecedented demographic challenges. Rising life expectancy and medical breakthroughs are swelling the ranks of our older population, absolutely, and in relation to working age Australians. And it's projected the number of Australians aged over 85 will increase from just over 500,000 in 2018-19 to 1.5 million by 2058. This means there are rapidly growing numbers of Australians in need of care, for longer periods and in need of care for more complex health conditions associated with longer life. Meanwhile, there are a relatively small number of working Australians providing the income tax revenue that subsidises aged care. As the system exists today, the federal government is the primary investor of $27 billion spent in the 2018-19 years. Some $20 billion came from the federal government. And the Parliamentary Budget Office predicts that over the next decade, federal government spending on aged care will increase by 4% per year, well and above the 2.7% increase predicted across all other areas of government spending at the same time. So the Morrison government is already investing significant money in aged care because we know that money as input is a critical part of the system. But what matters also is the outcomes for the investment that is being made to make sure that Australians get the support and assistance they need. And we should not accept poor standards, but we need to make sure that the standards that operate deliver outcomes for those who are vulnerable. And of course, there are significant consequences from the challenges of capital in the sector. First, aged care has to evolve into a ration-based system which has limited capacity to meet individual needs. The provision of services is shaped by the scarcity of available funding, meaning many are left on wait lists and those with high cost needs are provided an adequate service. And the system, of course, therefore lacks flexibility for some people, particularly from diverse backgrounds, whether they be cultural linguistic differences, veterans and people from the LGBTI community, to name some. Everyone is different. People are complex. Rigid, uniform and centralised systems will not comprehend the sensitivities of aged care. Often this not only fails to deliver care, but creates more suffering in the system itself. And we need to always be mindful of that, particularly when we're talking about Australians at one of the most vulnerable stages of their life. The report noted that smaller services perform better than larger centres because they had more capacity to focus on those individual needs. The success of those environments should inform our approach towards reform. We also need to make sure this governance model has lowered standards and allowed failings to go unnoticed and resolved. That is why the report recommends a new rights-based approach which establishes obligations to deliver high-quality, safe and timely support and care with choice and control, and that's of critical importance. Now, of course, what I go out and speak to people in the community about aged care, people have a diversity of attitudes, and it's heavily informed from their own life experience. If you talk to people who've had good experience in aged care, as many residents of the Goldstein electorate have had, and we're one of the homes of some of the largest private aged care providers, as well as residents of those aged care systems, the overwhelming majority of experience is good. Though people face particular challenges during the COVID-19 period, access and, of course, what happened when there was a COVID-19 outbreak. As you know, Deputy Speaker, 95% of the aged care deaths that occurred over the past year occurred in Victoria because of the consequences of community transmission. But, of course, there are other people who saw their family members be deceased because of the lack of access that people had, and, of course, particularly that was challenging in a situation where people didn't get the chance to see their loved ones before they departed. And we all share, no matter what side of politics, a compassion for families who never got that last moment, or they may have got it through a form of transparent glass. But there are also people, sadly, who want to use a discussion around aged care for some sort of ideological agenda. And I really want to stress how damaging this is, because aged care has private providers. A lot of them are community-based organisations who operate privately but receive government money. And I don't seek to demonise any of those, whether they're community-based providers or those who we have needed to invest in the system to build the capital so that when you go and seek out an aged care service, it is available to them. And what we've seen is failings in different parts of the sector and for different reasons. I outlined the failure of being able to ensure that people have individual care needs based on their ethnic or religious background, or, of course, their sexual orientation or gender identity. Other aged care homes that have been well-intentioned and have been motivated by a mission to support people from their community have often lacked the capital, which has meant that they've had to sacrifice services to keep their operations going. And that has a consequence too. And if there is any examples where you see a private operator that is a commercial operator that misallocates capital then away from service provision, that is a problem in itself. The challenge before us, Deputy Speaker, in developing an aged care system that sustains people for the 21st century is not to pursue ideological agendas. It is to understand the need that people require, the care that people require, and how we meet those needs. And sitting behind it is much broader discussions around the sense of responsibility that we have between each other as part of a culture and a society of mutualism. Where there is capital, the government can play a role, but there is simply capital required for capital investment. There is simply no reason why the private sector, whether charitable, commercial or other, can be part of the system to grow the system. So when you need aged care and the support and the home, it is there for you. Similarly, when it comes to the management, often that comes down to the costs of the individual and their responsibility and contribution. And when it comes to the service provision, particularly around healthcare, what operates inside an aged care home should be the same as what occurs outside the aged care home. where taxpayers have a responsibility to support each other. But when we seek to remove ultimately it's a debate about responsibility. Who is responsible for which section to make sure people get the assistance they need? Individuals have a responsibility, families have a responsibility, companies have a responsibility, and of course the taxpayer has a responsibility as well.
Yeah.
The